You try to stay strong and fake a smile until I
topic detoxification and biotransformation of xenobiotics. It's a very important topic. So many questions are there for university question. It's an essay question. Okay, short essays, short notes, all things are there in this topic. So very important topic. Okay, then next, what is meant by detoxification? We know what is this detoxification. Detoxification or detoxication that refers to the series of biochemical reactions occurring in the body that convert foreign or toxic substances to non-toxic or less toxic substances. Okay, when foreign body enter into our body, then we have to remove that toxic. It's a toxic substance. When foreign body enter into our body, it's a toxic substance. We have to convert that toxic to non-toxic or less toxic. Okay.
Yes.
Yes. And also one more thing, it should be soluble. It should be soluble, often polar, and then only it can be easily excreted. Yes. Our main purpose when foreign body enter into our body, it should be excreted. It should be excreted from our body.
Yes.
Okay. So that particular process is known as detoxification or detoxification. Okay.
Yes.
Sometimes what happens is that it's a mechanism. Detoxification is a particular mechanism that takes place in our body. So what happens is that sometimes detoxified product is more toxic than original substance. Okay.
Yes, ma'am.
Yes.
Yes.
It's a metabolism. When foreign body enter into our body, some compounds act on it and try to detoxify it. At that time, what happens actually is that it becomes more toxic than original substance.
Yes.
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 So at that time, what happens is that pro-carcinogens are converted into carcinogens. It's a problem of detoxification. Okay.
Yes, ma'am.
It's a disadvantage of detoxification. Methanol is converted to formaldehyde. Example, methanol is converted to formaldehyde, like that. Okay.
Yes.
Okay. Then next, then the word xenobiotics. We discussed that heading of our topic is detoxification and biotransformation of xenobiotics. Then what is this xenobiotics? Xenos means actually strange or foreign.
Yes, ma'am.
So xenobiotics are compounds which may be accidentally ingested or taken as drugs or compounds produced in body by bacterial metabolism. There are three possibilities for this xenobiotics, how it is enter into our body. Sometimes accidentally ingested. Okay.
Yes.
Then second time, at the time of some disorders or diseases, we take as a drugs. Okay, we take as drugs. Then third condition, that compounds produced in the body by bacterial metabolism. Okay, these three types, strange substances, foreign substances, that means xenobiotics enter into our body. Okay.
Yes, ma'am.
Then that should be molecules to be eliminated or detoxified. Which molecules should be which molecules are to be eliminated or detoxified are called as xenobiotics. Okay.
Yes, ma'am.
Now it is clear. What is xenobiotics? It is clear.
Yes,
Yes.
ma'am. Yes, ma'am.
Okay. In recent years, I already told you, in some cases of detoxification process, procarcinogens are converted to carcinogen. Yes.
Yes,
That toxic substance after detoxification converted to more toxic. Okay.
Yes.
So
Yes.
in recent years, the term detoxification is replaced by the word biotransformation.
Yes, ma'am.
Okay. Actually, that process is not detoxification, biotransformation. There is a transfer from its actual form. So that particular word is known as biotransformation. Okay.
Yes, ma'am.
So now we discuss three different names. Which are they? Which are they? Three different terms. I introduced three different terms. Which are they?
Bioinformatics, bioinformation, xenobiotics.
No, bioinformation. No, biotransformation. Okay.
Sorry. Biotransformation, xenobiotics, and detoxification.
Okay. Then, what is this biotransformation? biotransformation is not exactly synonymous with detoxification. Okay, the
Yes.
metabolites are more toxic than parent substance. We discuss it. This is
Yes.
known as bioactivation. There is a chance for the metabolites become more toxic than parent substance. This is known as bioactivation or toxication. It's a chance. Okay,
Yes.
during this biotransformation, there is a chance for bioactivation or toxication.
Yes, ma'am.
Okay, okay. Some example, biotransformation of vinyl chloride to vinyl chloride epoxide. What happens is that which covalently bind to DNA and RNA leading to cancer of liver. Yes,
Yes, ma'am.
actually that word procarcinogen is converted to carcinogen.
Yes, ma'am. Yes.
Yes,
Yes,
here
ma'am.
which compound, which is that compound? Now we are stressed on chemical compounds. Okay,
Yes,
okay.
ma'am.
Here which chemical?
Vinyl chloride.
Okay, vinyl chloride is converted to vinyl chloride epoxide.
Okay.
That then what happens to that vinyl chloride epoxide? We try
Then
to detoxify it, but what happens is that
it binds to DNA and RNA.
and forms
Cancer.
hepatic cancer, hepatoma, hepatic cancer. Okay,
Yes, ma'am.
okay, liver cancer. Okay, then then that's about our introduction. The main topics which we are going to discuss. So explain that. Give me the definition of detoxification, xenobiotics, and biotransformation now.
Detoxification means it is a series of biochemical reaction which converts the foreign toxic substance to non-toxic substance or less toxic substance.
Mm,
Uh, so for the foreign body should be easily for it to be easily excreted, it should be soluble and polar.
mm.
Xenobiotics means when compounds are accidentally taken into the body, either ingestion or as drugs, or as bacterial or produced in the body by bacterial metabolism.
Okay, drugs also known as xenobiotics. Okay,
Yes, ma'am.
three forms are the drugs, accidentally ingested
Ingestion,
compounds, and also the products formed by bacterial
bacterial
metabolism. Okay,
metabolism.
then
Yes.
what is this biotransformation? What is meant by biotransformation?
Biotransformation means metabolites that become more toxic after the ingestion.
Okay, okay. Then next we are entering into the chemical reactions, which compounds are in detail, compounds that are detoxified. Okay,
Yes.
we just discussed there are some accidentally ingested compounds, drugs are there, and products after metabolism by bacteria. So now we are entering into detail the compounds that are detoxified.
Yes.
First one, accidentally ingested compounds. Okay, three
Yes.
compounds, that is preservatives, food additives, adulterants, like that. Then second one, drugs taken for therapeutic purposes. Okay.
Yes.
Then third one, compounds produced in the body which are to be eliminated. We have to be eliminate that compounds like bilirubin, steroids. Okay.
Yes, ma'am.
Okay. Then what about bilirubin? What is the normal level of bilirubin?
Uh, um,
You love like clinical chemistry. Jaundice is over.
no,
Vandenberg test. Vandenberg test. Test for
no,
bilirubin.
no, ma'am.
Okay, okay, okay. Bilirubin less than 1 milligram per DL, that is the normal level. But in case of newborns, bilirubin levels will be high. Hmm?
Yes, ma'am.
What is the reason that we discuss in our physiology? Hemolytic disease of newborn, like the
No,
so many parts are there. In case of newborn, the level will be high. Normally, bilirubin level is the less than 1 milligram per DL. What happens in case of newborns?
it's high.
It's high. Why? What is the reason? What is the reason for that?
Um,
Rapid growth occurs. So, what happens? Destruction of hemoglobin occurs.
okay.
Bilirubin is the product of how
Mm,
this bilirubin formed? Bilirubin is the end product of which metabolism?
degradation of hemoglobin.
Heme. Hemoglobin means heme plus globin.
Okay.
Globin is the protein part. Globin
Yes,
is after degradation, globin converted to amino acid. Then
yes,
heme part. Heme undergo degradation and finally forms bilirubin. Okay.
Yes.
So at the time of delivery and also in pregnancy, rapid growth occurs. So destruction level is greater. So what happens? Normal bilirubin level of newborn is very high. Okay.
Yes.
Okay. Normally it is almost less than 10 milligram per day. Okay. Then after third day, after delivery, third day, it become gradually decreases. Then fifth day again decreases. Otherwise, we enter into phototherapy. You know, you know
Photograph.
about phototherapy in presence of UV light. Hmm?
Uh-huh.
Kids
Oh,
are
yes.
under phototherapy, black
Yes,
mask
ma'am.
on their eyes. Okay.
Okay. Yes, ma'am.
Okay. Yes. Okay. So what happens is that in presence of UV rays, bilirubin is excreted through urine. Aspirin is also given to reduce the level of bilirubin. Okay.
Yes,
Yes.
ma'am.
So simply in this point, we must know bilirubin level is high in newborns.
Yes,
Okay.
ma'am.
When it normal level of bilirubin, what is the normal level of bilirubin in adults? It is
Less
less than
than 1 milligram per deciliter.
1 milligram per dl, less than 1 milligram per dl. Okay. Okay.
Yes, ma'am.
1 to 2 milligram per dl is known as hyperbilirubinemia.
Yes.
Greater than 2 is known as jaundice.
Yes, ma'am.
Okay. So in case of newborns, what happens is that it is greater than 5 at the time of delivery, then it is decreases. But in some cases, some special cases, that bilirubin level increases to very high level.
Yes, ma'am.
Okay. Then there is a blood-brain barrier. That bilirubin crosses that blood-brain barrier and enter into brain. Hmm?
Okay. Yes, ma'am.
That particular condition is known as kernicterus.
Carnitine.
Kernicterus that causes brain injury.
Okay.
Okay,
Yes,
so
ma'am.
it's a normal situation. Bilirubin level increases in newborns, but if it is not controlled after 3 days, it is if it is not decreased, that will turn to a typical condition, serious condition.
Yes,
Okay,
ma'am.
that bilirubin enter into brain, that crosses bilirubin crosses this blood brain barrier and enter into brain. That particular condition is known as kernicterus, and that causes brain injury.
Yes, ma'am.
Okay, brain death will occur. It's a very difficult situation. Okay, so it's a simple topic now. We are not in the topic of bilirubin. Okay, high levels of bilirubin is toxic to newborns and leads to kernicterus brain injury. So bilirubin, we have to eliminate bilirubin. Bilirubin is a toxic substance in our body. That's all. So for this topic, bilirubin is a xenobiotic. Yes.
Yes, ma'am.
Yes. Biotransformation of what happens is that biotransformation of lipophilic bilirubin into hydrophilic metabolites occur in liver and excreted through urine.
Yes, ma'am.
Yes. 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 UV rays that excreted bilirubin through urine. UV rays, what happens is that bilirubin is degraded in presence of UV rays and excreted through urine. Okay. Hmm? So this, hello? Hello?
Yes, ma'am.
Yes.
Hello, yes,
Bilirubin,
ma'am.
yes, yes. Bilirubin, biotransformation of lipophilic bilirubin. Bilirubin is lipophilic. What is meant by lipophilic?
It gets soluble in fats, lipids.
Okay. So it should be converted to hydrophilic metabolites. Then only it can be excreted through urine. Okay.
Yes, ma'am.
Yes. Then compounds produced by bacterial metabolism. Okay. For example, amines are produced by decarboxylation of amino acid. Amino acid metabolism is over.
Yes, ma'am.
So you know what are the products of decarboxylation. What is meant by decarboxylation?
The removing of carbon dioxide from
And production of amines.
amines. Yes, ma'am.
Okay. So histidine forms histamine. Lysine, a small different name for lysine. It is not cadaver, cadaverine. Yes.
Yes, ma'am.
Anatomy cadaver, biochemistry cadaverine from lysine. Okay. Hmm?
Okay. Yes,
Then
ma'am.
ornithine, another name putrescine.
Okay.
Yes.
Yes, ma'am.
Lysine and ornithine is small difference. And all others are simple. Tyrosine, tyramine, tryptophan, tryptamine.
Yes, ma'am.
Okay. Okay. Then next. Transformation of xenobiotics can be either beneficial or harmful. Okay.
Yes, ma'am.
There is a chance for beneficial effect and also for harmful effects. That is depending upon the dose.
Yes, ma'am.
Then, for example, Biotransformation of acetaminophen. Acetaminophen, have you heard about acetaminophen?
No, ma'am.
It is main content in paracetamol.
Yes, ma'am.
It is the common drug.
Yes, ma'am.
We take that drug for all things. Yes?
Yes, yes, ma'am.
Paracetamol, 500 mg, Dolo, 650 mg. We take this medicine.
Yes, ma'am.
Minimum interval. What is the minimum interval for that drug? Did you know that?
Paracetamol, ma'am.
Yes, paracetamol. Acetaminophen.
Paracetamol, this duration.
Duration.
This hours or weeks.
Hours.
Yes, ma'am.
Minimum difference 8 hours, 6 to 8 hours. Okay.
Yes, ma'am.
We can take only 3 times 500 mg. Otherwise, what happens? Yes. So, transformation of xenobiotic can be either beneficial or harmful, that depending upon the dose. Here we are going to discuss our very common drug paracetamol. Paracetamol that contain a particular compound acetaminophen. Okay.
Yes, ma'am.
Small pharmacology topic. Okay. We entering into little part of pharmacology. Biotransformation of acetaminophen. It is commonly used drug paracetamol. Mainly we used to reduce pain and fever.
Yes,
okay. Normally undergoes rapid biotransformation and quickly eliminated in the urine and feces. No toxicity for this paracetamol normally.
Yes, ma'am.
If you take it 3 times or maximum 4 times, that's all. Okay.
Yes.
At high doses, what happens? The normal level for the detoxification of acetaminophen gets saturated. Then what happens? Excess amount that undergoes additional biosynthetic pathway that produces another metabolite that is toxic to liver.
Okay, yes, ma'am.
So our simple drug paracetamol will also lead to toxicity.
Yes,
toxicity to liver. Okay. That means overdose.
Overdose.
Okay. Normal dose, no problem. It can be saturated with enzymes for the metabolism of this acetaminophen.
Yes,
but
ma'am.
if it is taken as overdose, what happens? That is toxic to liver.
Yes, ma'am.
Yes. Then what is this? Which is the site of detoxification? Normally, the detoxification takes place in liver. That's all. That toxic product effect on liver.
Yes.
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 Or liver is a poor organ that done all the activities and it affects all the toxic products. First effect on this liver. Okay. So site of detoxification mainly in liver and also in kidney and other organ. The products formed by detoxification is excreted in kidney, that is mainly through urine, and less frequently via feces and expired in air. Okay. Yes. Then compounds that are detoxified. Can you name it? Compounds that are detoxified?
This thing. The drugs.
Drugs, okay.
Drug and the compounds which in body bacterial metabolism.
Like?
This
amines. Example for amines?
Amines which are produced during decarboxylation.
Okay.
Yes, histine will convert to histamine.
Not histine, histidine. Amino acid histidine.
Sorry, yes, histidine.
Okay, which type of amino acid is histidine? My favorite topic is amino acid. So, which was okay.
Acid, histidine base, I think.
Okay, basic amino acid. Okay.
Basic amino acid.
Okay. Histidine is the main amino acid that is present in hemoglobin. Okay.
Yes.
Yes. Histidine undergo decarboxylation and forms?
Histine.
Histamine. Amines are formed.
Yes, ma'am. Yes, ma'am.
Okay. Histamine. Then what about tyrosine? Tyramine. Okay.
Tryptophan, tryptamine.
Okay. Lysine?
Cadaverine.
Then ornithine?
Or I didn't get that word.
Putrescine. Okay. Putrescine. Okay. What is ornithine? It is present in urea cycle.
Urea.
What is ornithine? It is coming under, in classification times, it is coming under which category? Ornithine. It's a
Yeah.
derived amino acid. Okay.
Yes, ma'am.
It is derived amino acid that forms at the time of our metabolism. Okay.
Yes.
Okay. So it is known as a derived amino acid. Ornithine is a derived amino acid. Okay. Then,
Yes.
what is the harmful effects of xenobiotic transformation? Give me one example for harmful effects of xenobiotic transformation.
Uh, in overdose
Mm.
causes toxicity, or like uh, like paracetamol. After overdose, it causes toxicity to the liver.
Okay, which is the content present in paracetamol? Which content?
Acetam,
Content of paracetamol. Acetaminophen. Okay,
acetaminophen. Yes, ma'am.
acetaminophen. Okay. Then, next, site of detoxification.
Liver.
Liver and also sometimes in kidney and all other organs. Okay.
Yes, ma'am.
Okay. Then now we are entering into reactions.
Yes,
Okay. So mechanism of detoxification, how this detoxification takes place.
yes,
Okay. There are two reactions, phase 1 reactions and phase 2 reaction. Okay. In some
yes.
cases, there are also phase 3 reactions.
Okay.
Okay. So it's a simple process. Okay. So phase 1 reaction, what happens in phase 1 reaction? Alteration of fluorine molecule so as to add a functional group. Okay.
Okay. Yes,
We
ma'am.
add another functional group to that foreign molecule and convert it into another form.
Mm. Yes, ma'am.
Okay. That is phase 1 reaction.
Yes, ma'am.
Okay. Alteration of foreign molecule so as to add a functional group.
Yes,
Then
ma'am.
what happens in phase 2 reaction, which can be conjugated in phase 2 reaction? Conjugation occurs, combination with another compound. Okay.
Oh, yes, ma'am.
Already changed compound that become conjugated with another compound in phase 2 reactions.
Yes, ma'am.
Yes. Phase 1. Now we are going entering into phase 1 reaction. Phase 1 results with detoxification, in
Yes,
sometimes intoxication. Yes.
yes, ma'am. The
Detoxification means decreased toxicity.
uh,
Intoxification means
the
increased toxicity.
increased toxicity. Yes, ma'am.
For example, we already discussed methanol to formic acid, formaldehyde, formic acid, like that.
Yes, ma'am.
Yes. Okay. Then, which are the reactions coming under this phase 1 reaction? That is hydroxylation, oxidation, reduction, hydrolysis, dealkylation, and epoxidation.
Yes, ma'am.
Okay. Hydroxylation, oxidation, reduction, hydrolysis, dealkylation, and epoxidation. These are the reactions coming under phase 1 step.
Yes, ma'am.
Okay. Then phase 2. Phase 2, what happens? Products of metabolic transformations are either excreted directly or undergo further metabolism by phase 2 reactions. Okay? In
Yes,
very few cases, phase 1 products directly excreted.
yes,
Yes,
ma'am. Yes, ma'am.
most of the cases, what happens is that the products formed after phase 1 reaction or phase 1 metabolites that directly enter into phase 2 reactions.
Yes, ma'am.
Okay. Then phase 2 reactions, I already told you it's a conjugation reaction.
Yes, ma'am.
Hmm?
Yes, ma'am.
So that involves a conjugation with conjugating agent. So
Yes,
a
ma'am.
particular agent is there for conjugation. Yes,
Yes, ma'am.
that agent convert lipophilic compounds to hydrophilic, easily excretable forms.
Okay.
Simple.
Yes, ma'am.
So generally, what is the mechanism of detoxification? Phase 1 and phase 2. Phase 1 reaction means that convert the particular compound to another compound by the
Yes,
addition of a functional group.
yes, ma'am. Yes, ma'am.
Okay. So a particular metabolite is formed after phase 1 reaction. Hmm?
Yes, ma'am.
Which are the reactions involved in phase 1 reactions? You just name it.
Hydroxylation, oxidation, reduction, uh, hydrolysis, dealkylation, epoxidation.
Okay. Then what happens to that metabolites after this phase 1 reaction? In very few cases that excreted directly.
Yes, ma'am.
Okay. In all other cases that enter into phase 2 reactions.
Yes, ma'am.
Okay. What is this phase 2 reaction?
The phase to conjugation, that means combination with another compound happens, and it converts to hydrophilic, which is easily excretable.
Actually, it is lipophilic and it is converted to hydrophilic. Then only
Hydrophilic.
it will become easily excretable.
Easily excreted.
Okay.
Yes.
Then, which are the reactions in phase 2 reaction? Which are the reactions involved in phase 2? Can you, sulfation,
Mm.
okay,
Yes.
acetylation, okay,
Yes.
comma is there, methylation,
Mm.
and conjugation with glucuronic acid, glutathione, and glycine.
Yes, ma'am.
So, how many reactions are there in phase 2?
4.
For sulfation,
Sulfation, acetylation, methylation, and conjugation with glucuronic acid, glutathione, and glycine.
okay. In some cases, one more step, that is phase 3 reactions.
Yes, ma'am.
Okay. The phase 3, the products of phase 3 reactions may be products of, sorry, phase 2 reactions. Products of phase 2 reaction, in some cases, they are not detoxified. Again, enter into another phase that is known as phase 3 reactions.
Yes, ma'am.
Okay. Clear?
Yes,
Yes?
ma'am. Yes, ma'am.
It is tough or
No.
easy? No. Now you are clear.
Yes.
Reactions. We discuss all reactions in a happy mood. Then only that enter into our mind. Okay.
Yes, ma'am.
So maximum energy is required for this reaction. Okay.
Yes.
Any doubt? Just
Mm.
summarize. Summarize.
Um, the
I don't prepare any questions because you want to summarize. Okay.
Yes, ma'am. The from first, ma'am, or mechanism of detox.
Generally, no. Generally, phase 1, phase 2, phase 3. What is it?
Yes, ma'am. There are phase 1, phase 2, and phase 3.
Hmm.
Phase 1 is that alter the foreign molecule by adding a functional group.
Mhm.
Uh, that results in detoxification or intoxification.
And
That
toxification means?
increased in toxicity,
Okay.
whereas detoxification is decreased in toxicity.
Ah,
There are phase 1 has there are many reactions. They are hydroxylation, oxidation, reduction, hydrolysis, dealkylation, and epoxidation.
okay.
The phase 2, in which the products are transformed by adding by conjugation, that is combination with
Mm,
another molecule. The
okay.
molecule is the agent is lipophilic, which is
Mm,
converted to hydrophilic, that can be easily excreted.
mm,
Uh, the
okay.
reactions
Examples.
the sulfonation, acetylation, methylation,
Not sulfonation, sulfation. Okay. Mm,
sulfation, sulfation, acetylation, methylation, conjugation with glucuronic acid, glutathione, and glycine. So
okay.
further, they may enter into phase 3.
Mm,
Uh, that
mm.
phase
If it is not detoxified through phase 2 reaction, that can be
no,
enter into phase
yes,
3 reactions. Okay.
yes,
Okay.
yes,
Then one by one, we are entering into phase 1 reaction.
yes,
Okay. And we are entering into pure chemistry.
yes, ma'am.
You like chemistry?
Yes, ma'am.
Physical, organic, inorganic, or biochemistry? Which part?
Physical chemistry.
Physical chemistry, solute concentration, solvent.
Uh,
Yeah,
yes, ma'am.
problems.
Yes,
Problems. You miss it now.
yes,
You missed all physical chemistry.
yes, ma'am.
Okay, volumetric analysis, gravimetric analysis, and all that. Okay, now here we can discuss some organic chemistry. Okay,
Yes, ma'am.
now it is organic chemistry. Okay, phase 1 reactions. First reaction, which is the first reaction? Oxidation. Okay,
Yes,
so
ma'am.
oxidative reactions. Hmm?
Yes, ma'am.
Okay, so it may be either aromatic or aliphatic hydroxylation.
Mm.
Okay,
Yes,
The
ma'am.
reactions include sulfoxidation, N-oxidation, and epoxidation.
Yes,
Okay.
ma'am.
Okay. Then, for example, toluene. Toluene is hydroxylated to benzyl alcohol. Hmm?
Yes, ma'am.
Okay. So here is a mixed function oxidase system works for the conversion of toluene to benzyl alcohol. Toluene undergo hydroxylation and forms benzyl alcohol.
Yes, ma'am.
Okay. We will discuss with a structure, don't worry. Okay, first we
Yes,
just pass through this mechanism. Okay, toluene is hydroxylated to benzyl alcohol. A mixed function oxidase carried out this mechanism. Okay,
yes, ma'am.
then in some cases we already discussed, we need phase 1 and phase 2 reaction.
Yes, ma'am.
For the conversion of phase 1 is not enough, then what happened, that enter into phase 2.
Yes, ma'am.
Okay, so both are there, phase 1 and phase 2. Benzene to phenol and phenol to phenyl sulfate.
Yes, ma'am.
Benzene by the addition of, what is benzene, what is phenol?
Uh, Benzene is that six-membered ring.
Benzene,
Phenol has
okay.
alcohol group on the.
Which group is present in benzene at the time of phenol formation? Which
Uh,
group? Hmm?
Benzene, it has no group.
You can see the diagram now. Yes,
Diagram not visible.
slide is visible now.
The phase 1 reactions is coming. Now it is coming.
Now it is clear.
Yes, ma'am.
Yes, phase 1. First, the first picture is little bit of difficult. Okay, just mention toluene that contain benzene ring with
Yes.
CH3 group. So what happens is that toluene in
Mm,
presence of one enzyme that is converted to benzyl alcohol, mixed function oxidase. Yes.
yes, yes, ma'am.
Okay, phase 1 reaction, oxidative reaction, toluene in presence of mixed function oxidase, NADPH act as coenzyme that is converted to benzyl alcohol.
Yes, ma'am.
Hydroxylation, actually hydroxylation occurs. OH group is added.
Added.
CH3 is converted to CH2OH.
Yes, ma'am.
Is it clear?
Yes, ma'am.
Yes. Then next reaction we discuss benzene that is converted to phenol and through phase 1 reaction, that is hydroxylation reaction. Benzene ring contain hydroxyl group. It is known as phenol.
Yes, ma'am.
Okay. That is our phase 1 reaction. It's also a toxic product. So we have to convert the toxic product into detoxified product, that is by phase 2 reaction.
Yes, ma'am.
Addition of sulfate group.
Sulfate group. Yes, ma'am.
That what is the result? Phenyl sulfate.
Yes, ma'am.
Okay, sometimes both phase 1 and 2 reactions are needed to toxify a compound.
Yes, ma'am.
Yes. So we discuss first and second reaction. Toluene is hydroxylated to benzyl alcohol, benzene to phenol, and phenol to phenyl sulfate.
Yes, ma'am.
Yes. Next, one major compound that enter into our body. It's a very toxic product, that is alcohol.
Yes,
Hmm?
ma'am.
Yes.
Yes, ma'am.
So many alcoholics are there. So what happened to this alcohol in our body? We must know the mechanism. Yes.
Yes. Yes, ma'am.
So what happens to this alcohol? How it is detoxified? Oxidation.
Yes, ma'am.
Yes.
Yes.
Oxidation by two enzymes. Which are the two enzymes for the oxidation of alcohol? Alcohol dehydrogenase
Yes, ma'am.
and also aldehyde dehydrogenase. Okay.
Yes, ma'am.
We need two enzymes for the detoxification of alcohol. Which are
Alcohol.
the two enzymes?
Alcohol dehydrogenase and aldehyde dehydrogenase.
Okay, so we can see from this steps, ethyl alcohol. Okay,
Yes, ma'am.
ethyl enzyme is not there. I will explain. Ethyl alcohol in presence of NAD plus is converted to acetaldehyde. Hmm?
Yes, ma'am.
Enzyme is alcohol dehydrogenase.
Yes, ma'am.
Okay. Then what happens to this acetaldehyde? That is in presence of aldehyde dehydrogenase is converted to acetic acid.
Acetic acid. Yes, ma'am.
Okay. Then what happens to benzaldehyde? Again, in presence of aldehyde dehydrogenase, it is converted to benzoic acid.
Acetic acid. Yes, ma'am.
Okay. It
Yes,
is
ma'am.
clear. Yes.
Yes.
We use two enzymes for the detoxification of alcohol. That is our alcohol dehydrogenase and
aldehyde.
aldehyde dehydrogenase.
Yes.
Then the fourth category, oxidation of some compounds result in the formation of substances which are more toxic. There is a chance.
Yes.
Yes,
Yes.
there is a chance for the conversion of some after the oxidation process, it is converted to more toxic form.
Yes.
Example, methanol to formic acid, ethylene glycol to oxalic acid.
Yes.
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 Just revise in mind, okay,
Yes.
which are the four types of oxidation. First one, mixed function oxidase.
Oxidation.
Second one, oxidation and conjugation together. Yes.
Yes. Yes.
Then oxidation with the dehydrogenase enzyme,
Enzyme.
alcohol dehydrogenase and aldehyde
Aldehyde.
dehydrogenase for the detoxification of alcohol.
Yes, ma'am.
Fourth point, that is some cases what happens after detoxification it is converted to more toxic.
Substance. Yes, ma'am.
Yes. Then we discuss through the diagrams. Then next is reduction reactions. That is the second reaction takes place that is coming under phase 1. We discuss it phase 1 reactions, okay?
Yes, ma'am.
Okay. Reductases contain cytochrome P450 and flavoproteins.
Yes.
Cytochrome P450. It's a very big topic. Okay.
Yes, ma'am.
That is the main thing that involved in biotransformation reactions. It needs so many points to explain this cytochrome P450. So tomorrow's topic is cytochrome P450.
Okay. Yes, ma'am.
Okay. So it's an essay question, short essay question. Okay. Just cytochrome P450. You can search in university question paper. Okay. So reductases contain cytochrome P450 and flavoproteins. Normally, which compounds are entering into reduction for the detoxification? Nitro compounds.
Okay. Yes, ma'am.
Okay. Nitro compounds are reduced and detoxified by liver. These are reduced to amines. What happens to nitro compound? These are reduced to amines. Okay. Aldehydes and ketones, small amounts of aldehydes and ketones are also reduced and they are reduced to alcohol.
Yes, ma'am.
Okay. So, example, nitrobenzene to aniline, picric acid to picramic acid. You use picric acid in lab.
Yes, ma'am.
Which estimation we use picric acid? In which estimation? Did you finish your practicals?
No, ma'am.
No, okay. Estimation of creatinine. We use picric acid and sodium hydroxide.
Yes.
Yes? Picric acid. Okay, picric acid is alkaline creatinine picrate is formed. Okay, so picric acid. So picric acid to picramic acid. Para-nitrophenol to para-aminophenol. Little bit of difficult is there. But don't worry. Okay, nitro compounds. Stick on that point. Nitro compounds. Nitro compounds are reduced and detoxified by liver. These are nitro compounds are reduced to amines. Okay. Then aldehydes and ketones are reduced to alcohol. So nitrobenzene to aniline, picric acid to picramic acid, para-nitrophenol to